Today's episode is very special to me. One of the icons of the medical world, Padma Bhushan, Padma Shri, Dr. Naresh Trehan, Chairman and Managing Director Medanta, joined us for this episode of Duologues. Dr. Trehan, one of the early heart surgeons in the country, pioneered several innovative cardiac techniques, including minimally invasive and beating heart surgeries, and is known for his expertise in heart transplants. He is also the force behind Medanta, setting up the super specialty hospitals, which is a blend of advanced technology, ethical practices, and compassionate care. I hope you will find this episode as inspiring as I did while talking to Dr. Trehan. So good morning, sir. And
good morning.
First of all, I would like to thank you for sparing your time. I know that how busy you keep. And this conversation, I'm sure, is going to be very inspiring to a lot of people and for sure insightful. And to begin with, I must tell you that when Medanta, this whole campus came into existence, I was one lucky one to be having our office very close, just bang opposite to the road. And I saw this institution come up. And it's been roughly about 15 years.
Right.
To begin with our conversation, I would like to have your reflections on the values and principles based on which you established this institution in particular. And what are your reflections when you look back last 15 years on the very fundamentals of delivering top-class services to the people of this country and also the research which it continues to carry on?
So if you want to get the right perspective, we'll have to rewind back to 88.
Right.
When I established Escorts Heart Institute, I built it. It took 6 years. I was in the US for 20 years and did all my training. And then I was asked by New York University to join the faculty. So I was practicing in New York and always wanted to come back to India. But I did not want to just come with my own skills. I wanted to create that complete ecosystem in which you could deliver the highest end of cardiac care across all specialties and all maladies. Okay,
right.
And that we did. We started with 150 beds. We built it up to 330 beds. Trained over 100 surgeons, cardiologists, and also helped many, maybe over 50 hospitals to establish cardiac care centers, what we call heart command or cardiac care or whatever we did. So the whole idea was to let that need that India had so that people would not have to go overseas to get treatment in cardiac care,
right,
could be provided. And it's a great thing today. If you look at it 35 years later, I mean, even in small towns or small villages, there are some sort of cardiac care available, which
Absolutely.
is quite gratifying.
Right.
But in 2003, the realization came that although we had the largest heart institute in the world, freestanding heart institute in the world, that it was deficient. That when other specialties were required, we would not have the highest standard of specialists
Right.
available because it was a single specialty hospital.
Right.
That's when, looking around, and of course I already knew about it in the US, that there were institutions like the Mayo, Cleveland, Harvard, John Hopkins. These are the institutions that actually represent that platform on which you have all the super specialists on the same platform of the highest order in the world, and then be able to deliver care collectively to the patient.
Absolutely.
So the idea was that, and that's how the idea came to build Medanta.
Amazing.
Because never in the history in the private space was a hospital built of this size, 1,400 beds. And there were many doubts people had. There were many articles written saying, maybe I've lost my balance and it's a little crazy state to create something like this. But fortunately, it worked out. The concept was pure. And the good part was that, as you know, there is to create a successful healthcare delivery system, you not only need the physical structure,
right,
not only the technology, because these two things can be created and bought.
Right.
But the most important element is the human capital.
Right.
So because of the human capital, we had structured it much like the Mayo Clinic or the Cleveland Clinic. that each division, each super specialty would be headed by a chairman.
Sure.
And that chairman would have three attributes. One, they could be benchmarked to anybody in the world, not only locally.
Right.
So they had to be of that level.
Right.
The second was that they had reached a stage in their life that they're ready to give of themselves. That means that they are ready to teach others, let them grow the departments. So, and third was their integrity would be impeccable, because since the day I came to India in Medanta, no doctor touches money. The money is collected by the hospital, taxes paid, and then sent directly to the bank. So that way, there is a purity to the system, that there is no greed, there is no benchmark that the more you do, the more you'll get paid. The whole idea is higher quality and the highest skill set, best technology, give the highest kind of care with compassion, and try to keep it as affordable as possible. That was the whole driving principles of Medanta.
Right. I've stepped in sad many times into this institution, but lucky enough to always walk out happy. So I must compliment the kind of consistency in the services which continue to happen are commendable. Taking the next one from here on, sir, while I understand that building the level of talent you have and providing that autonomy to, say, starting from the chairman of any particular faculty within the institution, it's understandable that services will continue to be of the global standards. When it comes to enabling the ecosystem and continuing to uplift the skill sets which are required, research is also very important. And unfortunately, in our industry, I represent the electronics industry, the research has not happened enough in the past. And design-led manufacturing has started to happen now. How is that in case of the medical industry, in particular with Medanta? How is the research happening across here?
So, it is you can say, whether it's in your DNA or not in your DNA.
Right. Yeah.
I'm fortunate enough to train in New York University,
right,
which is one of the finest institutions around the world. And research, development, technology, exploration was embedded in our thinking
right,
from the very beginning.
Right.
So for my whole sort of push has been that we must, and there are two things that I live by, which is also dovetails into what you're asking.
Right.
Is Frank Spencer was one of the finest cardiac surgeon who was one of the finest teachers.
Right.
And I was fortunate enough to train with him. And besides all the other things that he taught us, there were two principles that still stick all the time, and I try to have my own trainees and my own colleagues imbibe the same, which says that if you are standing still, you're actually going backwards.
Right.
And if you're not better today than yesterday, then you wasted 24 hours. Because when you went to sleep, science has already moved. So this is the speed, velocity with which science is moving. And if we want to give our patients the best in the world, you need to be riding that wave all the time. So there is no room for complacency. When you say research, you're
right,
saying you are actually going into areas where you don't know where it's leading you to. So if you take the instance of the pharmaceutical industry,
Ji.
India is often called the pharmacy to the world, but pharmacy to the world for generic medicine, not for the cutting edge medicine. With the awareness that we have and all this whole movement of Viksit Bharat for 47 and Make in India, and all these things are very helpful, by the way. These banners are actually stimulating people into thinking differently. And I guess it's an environment.
Right.
Because somebody in the environment has said, let's move on, let's be the developed country of the world. And why not?
Of course.
Who thought about it? Our current Prime Minister is the one who's he's the cheerleader.
Right.
And he tells every day, what are we going to do?
Right.
And I think that also in this wave, medicine also hopefully will benefit. And I am the chair of CII, National Health Council. And this is our narrative every day to them.
Excellent.
Is to say, MedTech, wake up. Stop being very happy with just creating small cannulas and tubes and stuff like that. That's not science.
Absolutely.
That's not MedTech.
Right.
That is yes, you're providing a need, but there is the upper end has to be reached over a period of time.
Right.
Now you see what ISRO has done. ISRO is competing in the world.
Absolutely. Right.
And then, of course, you need the resources, you need the grit to do it.
Right.
But I think that's what is India's poised for and should be.
Right.
Because this whole thing of Atmanirbhar is a very, very important thing.
Yeah.
But there's another very important part to it, which I believe. And that is that if we can produce the kind of technology, the kind of medicine, the kind of end result that we can give, is we have 1.4 or 1.5 billion people. If we can create medicine for them, including the technology, then there are 4 billion people around us who are even in a much weaker economic state than we are.
Right.
I mean, you can look out, this is just what is needed.
Absolutely.
So if I can produce an MRI or a CT scan at 50% cost of what the monopoly companies are doing today, we may be able to be the biggest provider of healthcare equipment and technology to the rest of the world.
Absolutely.
Now, if you look at it, juxtapose it to the US, Europe, UK, there is no healthcare system which is not on fire.
Yeah, Dr. Trehan, I can surely imagine that while there is so much to do for our country, in our country, and you're already doing that through the services which you're providing, and I see rapid expansion of this institution happening, as you rightly mentioned. And I also see a lot of people coming in from elsewhere. And while I was driving up to the institution today, I saw a lot of buildings coming up who are providing residential services potentially to patients who are coming in from other countries. So in that sense, the rub-off of this institution is also going within the neighborhood and more. Would there be a situation, looking at the challenge which you just mentioned, which other countries are facing, while we'll continue to provide global services from institutions like these, would you also at a certain point consider opening hospitals into some of the other geographies?
Yes, of course, it's always on our mind. The basic thing is that each country has its own rules. Some of them welcome international doctors to create. Some of them are, the local bodies are very protective. and absolutely resistant. So there is a mix out there. The other part is the opportunities and which are the countries where people would like to live.
Right.
Our own doctors would like to live. So we are looking at it all the time.
Right.
And when the opportunity comes, I mean, we are already looking at 2-3 things right now. Yes, it is a good possibility. It hasn't happened as much yet. Some 1 or 2 things have happened, but yes, it is a good opportunity to take the services to underserved areas.
Sure.
Yes.
Sure. Sir, you championed adoption of automation within the industry, within the hospital industry, and change continues to happen. Is AI also disrupting or in some sense benefiting whatever happens in institutions like these?
In medicine, we have been using AI in its nascent form for a long time.
Right.
All the algorithms that we have developed on patient safety, new techniques of how to sense and predict. There have been machine learning. This has been all part of our development. Yes, the way AI has taken off now, it has even more potential for us.
Right.
And the basic thing, I'll give you a simple example, like today. So in the old days, or old days means even recently, we used to have our own methodology of your cholesterol, your stress test, and your X-ray, and these kind of things that would happen, right? When we said there are imprints available today, that is, genome sequencing reached a mature stage. Genome sequencing cost a lot of money till recently. And now one of the major companies, which is probably the best in the country, we have done a contract with them for our patients to do the genome sequencing for 10,000 rupees. It's come down from over 2 lakhs of rupees to 10,000 rupees. Okay. Now the question is, if you take somebody's genetic makeup, and in that genetic makeup, We have already been able to identify some of the genes that will lead to heart attacks, some of the genes that will lead to diabetes, and some of the genes that will lead to cancer. Now, mind you, in the non-communicable diseases, if you put these three together, they are the majority of non-communicable diseases or lifestyle diseases, as we call it.
Right.
Okay. So that gene sequencing, we take and analyze the genes, of course. The second thing to add to it is the phenome. Phenome is an individual.
Okay.
Your lifestyle, your body structure, and so that is your phenome. And then you take the digital health. The digital is what we measure. We will measure your stress test, your x-rays or your ultrasound and your echo and all that stuff that we do. If you put them together in one algorithm,
interesting,
you can do what we call today is personalized precision medicine.
Wow.
And simply put, it means that you can write today the health horoscope or health patri, like we call Janam Patri, we can do health patri for an individual today, to be able to not to scare them, but to make them aware of the fact that these are the things they should steer clear of.
Right.
Okay? Because if you already know I am prone to this kind of disease or malady that may hit me at some point, you may want to
prevent it.
Yeah. Okay. Right. How did we reach this state? We first said we became doctors to treat disease. And then we said, why let people get so sick? Right. Why don't we detect it early? So we said, let's do early detection. Early detection meant we established all these new tools of CT, MR, all these things.
Right.
So something is not growing out of your body, but you could check it inside only.
Right.
Right. Then we said, why let them get sick at all? So let's do wellness and make people aware of what is good for their health. Don't eat this, don't drink that. Blah, blah, blah. We painted the whole world with the same brush. As 7 billion people, we said, don't eat this. Right. Samosa is bad, jalebi is bad. You can't. So people did not follow it because you feel deprived. Yeah, it's on borderline deprivation.
Right.
So we said that the adoption, it's a failure. Our awareness program, which we have spent so much time and effort on, has failed. Because the adoption is only 3 to 5%. The world is getting more and more obese, more and more people are getting diabetes, more and more people are getting heart disease, more and more people are getting cancer. So obviously we are not making any progress. Working. So now we said, okay, what can we do to actually cull out that set of people who we can say, look, you need to, instead of the crude parameters which we used to use like family history and all that, why can't we use their genetic makeup? And say, look, truly, this will be your prescription. Then it doesn't ban you from, if you're not going to be a diabetic and you don't have high parameters to take you to heart disease and your genes support that, there's no reason for you to deny yourself a paranthi for all your life.
Right.
Or not eat a samosa for all your life.
You know, I personally grapple with this question. There is so much of hyperactivity happening and so much of information coming in through social platforms. Is the human brain ready for this hyperactivity?
You know, this has always been it's related to the era you are in.
Right.
Okay. Today, of course, the tools are such, the medium is such, that many more people can exploit it.
Right.
Okay. Now AI has made my life miserable also. Why? Because every few days there is somebody will fake some recommendation of medicine that I'm recommending.
Absolutely.
I have sued maybe 30, 40 times now. It comes down and then it pops up again. Something else pops up. So that it has its own dangers, because if people call me to say, should we buy this? Right. Somebody said, I already bought it, I've been taking it. So, this is actually criminal.
Right.
So that's why I'm saying that there are problems with AI.
Right.
There are problems with the way we live today. But there are very many good things also happening.
Absolutely. Right. Sir, creating anything from scratch is not easy, and you have done that, and it continues to deliver top class services. I'm sure there would have been set of challenges since your KGMC days to going to the US and then coming back with a mission and establishing an institution and then establishing what it stands today. There would have been your own set of challenges. How did you tackle, what kind of mindset did you exhibit to tackle challenges and then potentially convert them into opportunities?
I'll tell you, that takes me back to the lecture I gave at one of the IIM's convocation, where the title was, "There are no geniuses." Okay? If you think that I was born with some great vision that I'm following, it doesn't happen that way. There are certain characteristics you have, and how you actually pursue them, and that's your DNA, your determination or grit or whatever you may call it, that's fine. So it's a combination of things.
Right.
So if you want to know my thoughts on this,
Yeah.
see, first of all, I believe, and this is all retrospective, that if one pursues the natural talent that you have or you're born with, that will take you the farthest. For example, if you ask me from the age of 4, 5, because we were displaced from Pakistan, so nobody could afford a present in my family till about when I was 5, always I asked for a Meccano. Meccano was like the Lego of the old days.
Yeah.
So I used to be working with my hands all day, which is what my passion was. Okay. And then secondly, if you think about it, I became the president of the Aero Modeling Club of our school, modern school. And in those days, you used to get blocks of balsa wood and you had to carve everything out and make the parts and all that. So, in other words, that's one part of my talent. Okay. The other part was that I was born left-handed.
Oh.
But in those days, in some quarters, it was felt that you were unlucky if you were born left-handed. So my Hindi tutor used to break my knuckles over a pencil and say, change. So I changed. My handwriting went to pot because I was writing beautifully with my left hand. Now, sometimes but fortunately, I'm in a field where doctors are not expected to have good handwriting. So it's a joke. Only the pharmacists can read. Even the doctors may not be able to read their own handwriting. So that's what I didn't realize I was cursing him. But in this whole thing, I used to be I used to be in sports a lot. I mean, I used to play cricket, hockey. So I used to bowl with my left hand and bat with my right hand.
Wow.
Okay, so I thought I was bloody confused. This fellow has actually confused me. Right?
Right.
So I used to actually be very angry with him that I probably never get good because my hands are all confused. Anyway, when I reached surgery in New York, and when required for heart surgery, required very precise movements,
Right.
I realized that my colleagues and my teachers, they used to stitch with their right hand, but when it came to go around the anastomosis, they would have to go like this,
Right.
and one or two of them collapsed in the OT with their back discs going. But I found that I could easily switch the hands, and I used to go around like with my left hand.
Interesting.
And I've taught it to most of my people now,
Wow.
my own trainees. So that was a great gift that this person gave, especially when you're doing difficult spots. To get into difficult spots, it takes time. But I can just do it because it was given by this gentleman, my Hindi tutor. So when I came back from the US in one of my holidays, I brought him a big set of it, and I went to thank him.
Right.
So, you've given me a gift which will hopefully take me a long way.
Amazing.
So that's how things happen sometimes in your life.
Right.
And many things happened. I mean, when I first found out that who's the best heart surgeon, when I decided I wanted to do heart surgery and I was in US already, I said, who's the best heart surgery teacher? Everybody said the same. Frank Spencer at New York University, but why do you ask? He has a 5-year waiting list and he doesn't speak to foreigners. If my chief has not used this sentence, he doesn't speak to foreigners, and I didn't catch on to it.
Right.
Because I came home and I wrote him a letter, said it's a pity, I've come from India. There is no heart surgery in India. I have seen patients dying in my own hands because we knew what they have, but we can't fix it. So I've come all this way, but it's a pity I won't be able to be treated by you, trained by you, because in a way, I called him in a way like, you're discriminating or a bigot. So he wrote back and he said, no, that's not true.
Right.
I'm very happy to welcome you. You come on Thursday, such and such date, that there's one position left and it's an open competition, and you come.
Amazing.
So I was in Philadelphia that day, I drove to New York, and to my chagrin, the line was going around the block. I mean, there's so many applicants for that one slot. So fortunately, things happened in that.
Amazing.
Like I told you, there's no genius.
Right.
The guy who was interviewing me asked the right question.
Absolutely. Happened with me also.
Right? He asked me the right question, I could write the book on it. And he said, at the end of it, it's my subject, but you know more about it than I do. And you must meet Dr. Spencer. Those were the days of peak of hippie era.
Right.
So it was normal to have hair up to here and a buckle-handled mustache. And I never wore a tie. I used to wear jodhpuris.
Right.
Or a close collar. So I think that also helped, because Spencer said, where is this strange guy come from? But then once I got the highest marks in whatever must have happened, many people help you along the way.
Absolutely. Right.
So I think this whole thing of arrogance that I am so bright and brilliant and I am so great.
Right.
That's a terrible attitude to have.
Appreciate it.
And I'll tell you, and those are the people who find themselves lonely, alone.
Right.
Because they cannot understand their own self.
Right.
So, attitudinally, if you're on the ground, and luck will come if it will, as long as you're helping everybody, it's fine.
I can imagine that being a doctor, and in particular with your experience, you've seen life close and possibly death also close, sufferings, pain, happiness. You've seen emotions and life and death so close so many times. What is your understanding of life?
I'll tell you some practical things of life.
Sure, sir.
And this has actually been proven by a study done in the US. 50,000 people were followed for 20 years, meticulously, to see what happened to them 20 years later. And there are many studies done, but this is one particularly one I want to quote, is to say that people who were the most positive about not only for themselves but for everybody else, people who were giving them of themselves, people who had lots of friends and laughed a lot, and people who were social, they lived the longest free of disease.
Right.
Okay, so it sums it up that if you are behavior pattern, you can take the negative flip side of it, but you are saying positivity is your biggest thing. People add to their own stress, and there may not be any stress, but they add to it. So I'm saying that there is a lot to do. Okay.
Right.
So that is one part, the positivity of life. Second, I told you that there is a feeling one must have always, a little bit of insecurity.
Sure.
Because insecurity will drive you, not too much insecurity because it becomes a very negative force. A little bit of insecurity will always want you to climb the next mountain faster, which is a good thing to do. Third is a lot of luck. But luck comes to many people. The point is that if you were at that time smart enough, and I'll give you the example of a surfer, on the ocean.
Yeah.
The surfer waits for that wave to come.
Right.
The one who catches the highest wave and goes on it the longer, he'll travel the longest distance.
Absolutely.
Not that the waves are not coming, the waves are coming.
Yeah.
But it's that surfer who's lucky enough or smart enough and lucky enough to get onto the highest, he'll go the farthest.
Right.
So life will take you.
Absolutely.
But along the way, if you have created goodwill, it'll always come to your rescue.
Right.
Never you'll go through difficult times, and believe me, I've been through many.
Right.
But it's always the goodwill that you had created that helped you to move further in life.
So in this wintry mornings and the weather is so cold, a lot of people would make excuses to say step out of their comfort zones to go for a walk. You keep yourself so fit and you have a busy day, busy weeks, busy months. What do you do to keep yourselves fit?
First, I'm a continuous practitioner of yoga.
Okay.
For 33 years now. For keeping up, this is an opportunity to talk about people's health.
Right.
So you must look at yourself as health by decade. It doesn't matter till the age of 30, you can eat anything, you can drink anything. It's very difficult to kill a body before that.
Sure.
Once you cross 30 to 40, your metabolism starts slowing down, and what you could eat and just be fit doesn't stay that way. It starts putting on belly, weight and all. Then you cross over to 50, when your hormones starts becoming a little less and less.
Right.
Okay. Then you cross 60. By that time, your biggest danger is your muscle mass starts reducing. Okay. Muscle is immunity. Muscle is the driving force that will keep your metabolic state intact. And immunity is all that is required to keep you safe from many of these infections and stuff like that. And as you get older, this muscle mass, if you don't actually take care of it, will diminish.
Okay.
So what do you have to do? One, yoga is extremely important for two things. One is for your mental state, because that's the most relaxing or de-stressing thing you can do for yourself. That's the Lom Vilom and all the other things, pranayama of yoga. And the exercises of yoga, like Surya Namaskars and all that, they stretch your body, all the ligaments and all that, and keep your body supple, because the next thing you do is you get stiff. People can't get up from so it prevents that from happening.
Right.
Third is exercise. So exercise is to build your muscle.
Sure.
So I'm doing Pilates now, which is the least, it doesn't bulk your muscles, but it keeps them healthy, toned. That's what you need.
Right.
Toned, healthy muscles, not necessarily pumping iron, which actually is hurtful over a period of time.
Right.
So these are the kind of things you can do to be active, and then it depends. But, you can be the healthiest, you can be and still get unlucky with something.
Then my final question, sir. You're doing good for the society and you're contributing immensely in your own way. What is that purpose which still continues to wake you up every morning to do what you do?
For the moment, I won't want to paint myself as somebody who doesn't have flaws. I have many. But at the same time, I do have that I'm driven by my passion for what I'm doing. So for me to get up at 5 in the morning, or even this morning I was woken up at 3, my phone is never off. Somebody's got into trouble, in the sense needed emergency admission. They called me at 3 o'clock, took me half an hour to get everything organized, then I went back to sleep. But I went right back to sleep and woke up at 6 o'clock, and you have a sense of purpose. If you don't have a sense of purpose, that's the biggest negative you can have.
Right.
And that's why it's important that never not have a purpose. Now, it does not mean that you drag yourself out. Like if I'm a surgeon and if my hands are shaking, you check them, everything's fine, okay, ready to go to work.
Amazing.
But the basic thing is, if you are a disconnect somewhere, but does not mean even if you retire, that's fine. Switching gears is nothing wrong with it. But the point is, there should always be a sense of purpose. And there are so many things one can do.
It has been an honor talking to you, and very inspiring. I got so engrossed listening to you up close, and I find myself very lucky. I wish you all the best for the new
Thank
year
you.
and more to come. Loads of happiness and good health to you, and may you continue to inspire the generations. May you continue to contribute for the society as much as you are doing. And I wish you all the best, and all the people
Thank you.
who have joined you for this very, very noble cause. Thank you
Thank
very
you,
much.
and thank you for having me on your duologue.